station, 1370 WOCA. Ocala.
Crying. Now I want to understand.
All right, 5 minutes after 9 o'clock. You know, it only makes sense that we have a camera in the room when there's an eye doctor, because it's all about being able to see who you're talking to. And we got the camera going, the live streaming, and Dr. Michael Lange is here to answer your questions about your eyes, also about your nutritional health. Dr. Lange has kind of a two-track profession he's been on for a long time. He's a certified nutrition specialist, and of course we all know him as a board-certified optometric physician as well. Good morning, Dr. Lange.
Good morning, guys. It's great to be here.
How you doing?
Fantastic. Absolutely wonderful.
And do you have another doctor calling in today?
Yes, Dr. Shalace Kaushal, MD, as well as a PhD. We'll be calling in very shortly. He is now our retina specialist at Lange Eye Care in Ocala. So he actually is still living in Massachusetts, so he flies in and sees patients about 4 times, maybe 5 times out of the month. And he is going to be down here full-time soon. So we're blessed. He used to be the head of retina at Shands, University of Florida, and then he went to Massachusetts and became the chairman of ophthalmology at University of Massachusetts. And Dr. Kaushal is also involved in a lot of genetic and stem cell research for macular degeneration, diabetic retinopathy, retinitis pigmentosa, different retinal diseases. So it'll be great for our audiences to learn a lot more about what Dr. Kaushal has to offer.
Oh, excellent. You know, it always seems to me when I hear you talking about the health of the eye, that the front of the eye, where the cornea and the lens are, if you have trouble there, it's easier to fix than the back of the eye, the retina, right? It's more serious at the back of the eye?
Really, that's absolutely correct. I mean, now we have great cataract surgeons that if you develop a cataract surgery is relatively, I shouldn't say simple, but a surgical procedure that is a very good procedure, and you can get instant gratification. Even corneal problems, we have corneal transplants, but you're very correct. The retina is a very complicated structure in the eye, and a fellowship-trained retina specialist is who people really want to see, especially if they have diabetic retinopathy, you know, wet form of macular degeneration, any type of retinal disease. And that's why we're real happy of having Dr. Kaushal calling in on this morning.
And Robin just let me know that he is on the phone. You ready to go to that line? Let's say good morning. Good morning, Dr. Kaushal.
Good morning. Good morning.
Thank you for being on. Hopefully you can hear each other. Can you hear Dr. Kaushal? Good.
I hear him fine.
Good. And where are you today?
I'm in Massachusetts.
Oh, you're up. Oh, wow, you're up in Massachusetts. Wow, and you're down. Dr. Lange says you're here like every week or every. How often are you here?
I'm coming every once a month for about a week, and I'm planning to make the transition to full time soon.
Just for the listener's sake, if you have a question, this is a great time to call. We've got 2 eye doctors on the air with us right now. The number is 622-9622. And do the retina issues that we talk about, are they caused by lifestyle? Are they caused by genetics? Is it a combination?
It's both, actually. We know there's been a significant, exciting research over the last 10 to 15 years, which has demonstrated that certain retinal diseases have a genetic component, for example, like retinitis pigmentosa. Right. Some of the inherited diseases, macular diseases like Stargardt's disease. And even more importantly, the more common retinal diseases like age-related macular degeneration. Nearly 70% of patients with age-related macular degeneration have certain changes in their DNA called polymorphism that are genetic and that predispose them to developing the disease in the presence of certain environmental risk factors as well.
Wow, is that changeable? I didn't realize our DNA could actually change as we get older.
Well, not that it changes. We're born with those changes. What I mean to say, or to clarify, is that those certain types of changes in our DNA, in the population in general, predispose us to certain, coupled with environmental factors, couple us or make us more susceptible to macular degeneration.
Does knowing that in advance give doctors a way to cut it off at the pass, so to speak, so that it doesn't?
That's a really great point. Indeed, we know or have begun genetic testing in patient populations, both in a research setting and more recently through clinic-based testing. We can now start to predict in a meaningful way those patients who are high risk for developing the wet form of macular degeneration, where there's new blood vessels that form underneath the retina and into the retina. Fortunately for that form of the disease, which accounts for about 10 to 15% of patients worldwide, we now have potent medications that we can inject directly into the eye that can help control those leaky, abnormal new blood vessels.
Oh, wow.
And also, Larry, these patients, we do these genetic tests now at the Lange Eye Care locations, and this really helps the primary eye care physician, I call the optometrist, help the patient be more proactive in their future retinal health. Because let's say we do a genetic test and it comes back that it's a high prediction that they're going to develop the wet form, a more visually devastating form of macular degeneration. Then, number one, we can see these patients a little bit more frequently. We can do OCT, cross-sectional imaging of the retina, but we can counsel these patients on things that we talk about in this program all the time: nutritional changes, dietary changes, lifestyle changes, the importance of wearing blue-blocking sunglasses, losing weight, smoking cessation. I mean, things that we can counsel them on that may ultimately help decrease the chances of the dry form going to the wet. And then, of course, setting an appointment to see Dr. Kaushal, who is a retina specialist, because then with new technology that Dr. Kaushal has at his fingertips, new technology, even new generation oral medications, injectable medications, things of this nature, may be beneficial. So that's why it's kind of exciting to have this genetic test available now, so we can, like I said, help these patients help themselves.
Okay, and I think Dr. Kaushal dropped off and came back on.
I'm back.
There you are. Okay. Well, thank you for calling back in. Though this is really serious stuff. Now, we've somehow become spoiled by some of the treatments that we hear about, like LASIK and some of the things you do at the front of the eye, because it seems like people go in, and a few hours later they're out. There's no long period of time anymore. Is that same thing true for the back of the eye, the retina? Is it quick?
Retina's very different. As Dr. Lange was speaking to earlier, cataract surgery and the evolution of not only the surgical techniques but also the surgical instruments have profoundly changed the way the surgery is done and what the surgeon and the patient's expectations are, in part because nowadays the surgery is fairly quick for a patient, and quick and efficient, where lens can be, the cataractus lens can be removed and the new lens placed into the eye. Retinal surgery also has been going under constant evolution over the last 40 to 50 years. Indeed, the procedures that used to take us, let's say, 2 to 3 hours, some instances those surgeries still take 2 to 3 hours, but routine surgeries in retina can be done usually anywhere from 30 to 45 minutes. And that's fairly remarkable, given 10, 15, 20 years ago, when the same procedures might take double the time.
Is a retina transplantable?
That's a great fun topic to talk about. There has been significant interest in transplanting tissue into the retina. So for the sake of the listenership, the retina is a diaphanous clear structure. It's the photographic film of the eye that's no thicker than tissue paper and attached to the inner wall of the eye. And in certain diseases, like, for example, macular degeneration, retinal degeneration, diabetes, and so on, there can be significant loss of cells in the retina. And there's been great interest in transplanting retinal tissue en masse, in other words, as a large chunk of tissue, and also in transplanting cells, stem cells in particular, or stem cells that have been made into certain types of retinal cells. And so the answer is yes, it's possible to do these surgical procedures. These techniques have been also developed over the last, I would say, 15 to 20 years as well. But they can, the success of those remains to be determined because there's many other components. The actual physical ability of retinal surgeons to place cells, tissues, or even drugs for that matter, underneath the retina is I wouldn't say routine, but can be done with a fairly routinely.
Yeah.
But the ability to make those types of cells and tissues that are transplanted actually functional, that's the challenge our field faces at this time.
My goodness. Any improvement at all in that must be very exciting for everybody.
Yes, absolutely. And some of the listeners may have been aware there's been great excitement in stem cells as possible ways to rejuvenate or actually resuscitate, quote unquote, resuscitate the retina over the last couple of years, and certain trials are underway, both in the U.S. and elsewhere in the world, in Europe in particular, England in specific, to look to see if we can not only do these procedures but then regain visual function, because at the end of the day, for a patient, it's even if tissue is transplanted, the real key is to have that tissue both viable and functional, so that the patient can have improved vision.
Yeah.
And that's where your field of expertise, one of the fields, is so valuable, Dr. Lange, is that you're able to detect things that are going wrong before they are totally lost, and you're able to help the preventative.
Right. The key is early detection, absolutely. And that's why, we emphasize on this program how important routine eye care is. Patients should get into their ophthalmologist or their optometrist and have their eyes dilated on an annual basis, because the key is early detection. I mean, the evolution of retinal treatment since I've been in practice has been amazing. I mean, it wasn't too long ago where if we had the wet form of macular degeneration, when you had fluid building up in the retina or bleed in the retina specialist would actually take a laser and try to coagulate that bleeding, and that laser would actually make the vision worse. And then we came to cold lasers, or something called PDT therapy, and now we've emerged into injectable medications that Dr. Kaushal is an expert in, things like Lucentis and Avastin and now Eylea, where it makes the possibilities for patients' overall vision much better, improved vision much better than it was in just a few years ago. So, Dr. Kaushal, would you say that the evolution over the last 15 years of retina has really come a long, long way?
Yeah, absolutely, absolutely. It's an extremely exciting time for us in the field, but even more importantly for patients, there is a real chance where, as you rightly pointed out, not too long ago, we were using laser treatments, both hot and cold lasers, as gold standards of care, and it was a challenging conversation with patients, because the concept that sometimes was difficult to convey is that the laser treatments would destroy retina to preserve vision long term. And that's a very difficult concept, because in most of medicine, what we try to do is improve function. And now, as you pointed out, with the injections of these types of medicines, these anti-angiogenic drugs, drugs that prevent new blood vessel formation, like Lucentis, Avastin, and Eylea, and even to a limited extent steroids as well. They've absolutely revolutionized the way we manage and think about patients. For example, macular degeneration, diabetic patients, or other patients that can develop swelling in their retina because of abnormal new blood vessels.
If medication can correct the problem, can nutrition prevent it? Is there a way to kind of stop it before it ever happens, just by eating right, or maybe just taking supplements or something?
Yeah, I'll let Dr. Lange comment first, because he's very, very well versed in the role of nutrition and in overall health and in retinal health, and I'll add some comments afterwards.
Right. Yeah, that's a great question, Larry. And I think absolutely, in my opinion, without a shadow of a doubt, proper nutrition, lifestyle adjustments, dietary changes are crucial for the macular degeneration patient, for the diabetic patient, well, for all of us, for that matter. And I think that should start early in life, all right? If somebody comes in and has fairly advanced macular degeneration, I see them, certainly I'm going to alter their diet and put them on the correct supplements that I believe can help these patients, but it's not going to really reverse some of the damage that's already occurred. I have seen patients improve. I have seen many patients improve when we put them on the right supplements, and that's why I developed the Fortify Complete Macular Defense. I think the right supplements in combination with the right diet and lifestyle adjustment is a very powerful way at helping to slow down the degenerative phases of these diseases, and in some cases, yes, I see many cases where they do have improvement, and that's where when you combine that with traditional medical and surgical treatment, it's very, very powerful. But the problem is many people out there, and many doctors as well, do not understand nutrition, and they're recommending some things that may actually create more harm. Yeah. So people are taking vitamins that may actually cause some faster age-related changes in the body as well as in the eye.
Wow, that's pretty scary. We got to educate the doctors now, right?
Educating the public and educating the doctors, absolutely. And that's quite frankly something that, doctors that go through optometry school or medical school, you don't learn enough about nutrition. So that's something that you have to really kind of get on your own. And that's why I became a certified nutritional specialist. And I go to, hundreds of hours of continuing education a year in nutrition, actually probably more in nutrition than I do in optometry. So we'll let Dr. Kaushal chime in on this as well.
Well, Dr. Lange makes some very important points. First, many of us who have gone to medical school, trained in ophthalmology, trained in retina, we have very limited exposure to the nutritional components that are critical for eye health and overall body health. And I think one of the reasons that one of the things I've been very impressed in seeing the opportunity, seeing the retina patients in his practice, is that indeed these folks who are taking nutritional supplements, and I should, in the spirit of transparency, let everyone know that I have no financial interest in what Dr. Lange has developed. I've been actually pleasantly surprised, and it spurred. I've had a significant interest in the nutritional approaches to retinal diseases, in part because of our own research that uncovered many nutraceuticals, compounds that are found in natural products, and their protective effect in cell culture, in petri dishes of various cells of the retina that we can grow in the research lab, as well as in mouse models. And that's where...
So you can actually see it working then.
Yeah, Dr. Lange and I resonate on that. And indeed, as I've started to learn more intensively over the last 5-6 years the role of nutrition, I would have to agree, even when I attend both national and international meetings on retinal diseases, there is a groundswell of interest among retina specialists throughout the world in the role of nutrition and in eye care and in overall health. And I think that Dr. Lange is actually probably ahead of the curve compared to most people, if I can say that. But there is clear mounting evidence almost on a monthly basis in the medical literature of the role of nutrition and eye health. In fact, in the prevention, as you were asking that question earlier on, in the prevention of diseases like diabetic retinopathy, like macular degeneration, and even in certain genetic diseases of the eyes, it's become clear the important role of nutrition and overall body health in slowing or preventing preventing the hastening of the disease itself.
If I can go back a little bit to the DNA and the genetic part, if we have a predisposition to have macular degeneration or any retinal issue, and I know this is a theoretical thing at this point, but we were to use a transplant of some sort, would the fact that the transplant clearly would have a different DNA because it comes from a different person, maybe ensure us about our own DNA actually hurting the new transplant?
Oh, you're asking a very important question, and if I can recast your question into a slightly different way,
Okay.
and say it this way, what you're really asking is, geez, if we transplant, let's say, cells of the retina or tissues of the retina underneath the retina, there's maybe a couple layers to your question. First is there the possibility of the new tissue being recognized as foreign and being rejected by the eye? And that is a very serious concern for us who think carefully or are interested in these types of approaches. And the answer is yes, there could be rejection of that tissue. We know, for example, in corneal transplants, there is the possibility of the new cornea being rejected by the person receiving the cornea, the recipient. So the same way, retinal tissue could conceivably be rejected. The new tissue could be rejected. However, on the flip side, there's many potent drugs that have been developed to prevent rejection by the immune system or the body of foreign tissue. For example, these types of medicines have been used for a long period of time, for example, in kidney transplant, liver transplant, and so on. And so likewise in retina, it's believed that there's a role for such drugs. The other part of your question is could the transplanted tissue, because it is from a different person, could that protect longer term because it doesn't have the same genetic makeup? And the answer is yes. That's part of the attraction of doing something like that, doing these procedures. And then the third part of your question is, you may not have even recognized that you had three parts to your question. The third part of your question, which is even more interesting to think about, is could the tissue that's been transplanted, could it help the body potentially reverse the changes in and around where that tissue is transplanted? Now, that sounds like almost a trivial question, but it's a very real question, and retinal scientists and vision biologists, there's some beautiful studies that have been done by the folks in our field to show that transplanted tissue can sometimes even reverse the changes that occur in the adjacent tissue and help change the functioning of those cells outside of the region that's been transplanted. Now, that's very exciting because you might imagine, for example, that you transplant a tissue in a small area. But if you could have so-called, long-term effects elsewhere in the retina, that would be particularly exciting because that could potentially slow down and or reverse the diseases in the region that wasn't transplanted.
Wow.
That's some very exciting times to be in the eye care field.
Mm-hmm. You're not kidding, or to need eye care. I mean, it seems like right now you have a better chance of at least stopping something in its tracks, even if it's not completely reversible.
Right, and this talk show and doctors like Dr. Kausho, really give hope to a lot of patients out there that really don't think there is hope. We get a lot of vision impaired people that listen to this program, and just listening to Dr. Kausho will give them a lot of hope. If you're not too old, as long as you're not 101 and you don't have one foot in the grave, there may be some hope. We may be taking people out of the darkness down the road.
Well, this has been a great show. Dr. Kausho, thank you for coming on today with Dr. Lange. We've been a fan of Dr. Lange's for a decade or more, and know the great work he's done. What I'm always impressed with the nutritional stuff is that there's a constant evolution of the formula, because you're constantly recognizing things that need to be taken out and added.
Right.
I mean, so many times you'll say you have to have this. Somebody else will say, and what was one? Beta carotene was one.
Right.
That you said we didn't understand that at all.
Right. We took the beta carotene out a while back because we notice now that it may have effects where it actually blocks the absorption of lutein and zeaxanthin, which ultimately we do not want to be doing for macular health. So, yes, 4 to 5 items is an evolution. We're in our 9th revision of the formula, which will be out in about 2 months. And once again, if anybody is interested in seeing Dr. Kausho for a retinal evaluation, they can come to the main Ocala office, or they can call 237-3768. That's 237-3768. He's available. He comes down for about a week each month, and hopefully in the near future we'll even have him more full-time. So we're real excited about having Dr. Kaushal on the team.
Wow, great. Thank you, Dr. Kaushal. Thank you, Dr. Lange. Hopefully you'll both be in the studio at one time.
Sounds great.
Still online? Okay. Great stuff. Wow, and that'll be up online. Robin will put the video of this. You'll see Dr. Lange and hear Dr. Kaushal on Facebook. It'll be there before half hour's up, I bet you. All right, thank you, Dr. Kaushal, again. Thank you, Dr. Lange.
All right, have a great day.
We'll take a little break, and Jacques Cousteau's grandson is coming up next. We'll be right back.
Ocala's information station, 1370 WOCA. Ocala!
The weather is brought to you by myfwc.com. Life jackets save lives. Wear it, Florida. Sunshine mixed with clouds today. A couple of thunderstorms around this afternoon and this evening. Our high today 89 to 93. And partly cloudy skies later tonight, low 73 to 77. But tomorrow, partly sunny. Best chance of a thunderstorm in the afternoon and evening, the high 90 to 94. Friday, partly sunny, high 90 to 94. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Got trees? Need a tree or two? Then you need to get on over to Bob Wine's Camellia Gardens in Ocala, where you'll find this area's biggest selection of quality trees at the lowest prices guaranteed. Now you can get 2 trees up to 10 feet tall delivered and planted in your yard for just $199. That's a real deal.